Cadian Birch, the Director of Program Coordination, Planning and Strategic Initiatives, acting in the Ministry of Education, Youth and Information, Dr. Nicola Skyers, the Director of Disease Prevention and Control, acting at the Ministry of Education, Health and Wellness, and of course, Dr. Julia Rowe Porter, the Media Epidemiologist in the Ministry of Health and Wellness. Along with the team from the Ministry of Health and Wellness, we also have Dr. Kassan Troop, the Chief Education Officer acting, and of course the communications team from the ministry. Thank you so much for joining us, those on our Zoom platform from the media, and of course those in the wider public joining us on our various stream platforms. May I then now invite the Minister of Education, Youth and Information, the Honourable Favour Williams, for a report on Cabinet's deliberations over the past 2 weeks, followed by questions from members of the media. Minister.
Good morning, everyone. Thank you, Madam Moderator. Let me acknowledge the presence of the Honourable Robert Nesta Morgan, Minister of State in the Ministry of Education, Youth and Information, Dr. Grace McLean, our Permanent Secretary acting from the Ministry, Dr. Kassan Troop, our CEO acting, Mr. Dunstan Bryan, Permanent Secretary of the Ministry of Health and Wellness, who is on Zoom, with his team as well, to the team from the Ministry of Education, Youth and Information, and all our media friends that are online. Good morning again. Let me begin with the transfer of St. Joseph's Hospital to the Southeast Regional Health Authority, SERA. Cabinet gave approval for the transfer of the management of St. Joseph's Hospital, located in St. Andrew, from the Ministry of Health and Wellness to the Southeast Regional Health Authority. Currently, the hospital does not operate under the management of a regional authority, but operates as a public health facility which only offers private services. The hospital is classified as a public hospital under the National Health Services Act, and the Act allows for the transfer of the assets and liabilities to SERA. The transfer will not impact the approximately 154 members of staff employed to the hospital, nor have any negative impact on the public-private partnership arrangement for the hospital to have a center of excellence in oncology and nephrology. Continuing on the health sector, focusing now on exemption of fees at public pharmacies for all persons with sickle cell disease. Cabinet gave approval for the exemption of fees at public pharmacies for all persons with sickle cell disease who access care at the University Hospital of the West Indies Sickle Cell Unit. This will enable them to have their prescriptions that they would have obtained from the Sickle Cell Unit, to have these prescriptions filled at public pharmacies at no cost to them. There are approximately 18,000 persons with sickle cell disease in Jamaica, and 22%, or 3,600 of these persons, currently seek care from the Sickle Cell Unit at the University Hospital of the West Indies. These persons were not able to access medication that was available free of cost to sicklers who sought care in the public health system. The projected annual cost of providing service is approximately $36 million, which will be funded from the pharmaceutical budget of the Ministry of Health and Wellness. In the area of special needs students, we have a memorandum of understanding for the establishment of Macam Child Care Center as a government-granted aided educational institution. Cabinet gave approval for the Macam Child Development Center, located in St. Andrew, to be designated a government grant-aided educational institution with effect from September 1, 2018. The approval will also allow for the establishment of a memorandum of understanding between the Ministry of Education, Youth and Information and the Macam Child Development Center. The McCam Center was opened in 1986 to respond to the needs for educational programming for children with a range of special needs. The center is devoted to the provision of educational opportunities for students from as early as 3 months old and a specialized program for young children with autism that is aimed at building their communication, social, and academic skills to ensure inclusion in the general primary education system. McCam's services have grown over the years to include educational assessment, therapeutic intervention, parent group counseling, and professional training. The center is located in the St. Andrew Eastern constituency, which has the largest population of adults and children with disabilities. And just to mention, in terms of the institutions in St. Andrew Eastern that cater to the population with disabilities, those include the Danny Williams Primary School for the Deaf, Listamere Gilby High School for the Deaf, the National Children's Home, Tegwin School, Carberry Court, Hope Valley Experimental, School of Hope, Mona Rehab, which is another institution, and of course, for adults, there's the Cheshire Village community. The partnership with McCam will continue the contribution to the achievement of universal early childhood education by providing a minimum of 5 years of education to all students at the institution. This cabinet approval is a further indication of this administration's continued support and investment in the special needs community. Jamaica's candidature for re-election to Category C of the Council of the International Maritime Organization for the 2022 to 2023 biennium. Cabinet gave approval for Jamaica's candidature for election to Category C of the Council of the International Maritime Organization for the 2022 to 2023 biennium. The IMO, which is International Maritime Organization, is the United Nations specialized agency with responsibility for safety and security of shipping and the prevention of pollution by ships. The Council is the governing body of the IMO when the Assembly is not in session biennially. The Category C, which Jamaica is associated, represents 20 states that are deemed to have special interest in maritime transport or navigation. The election to the Council would ensure the representation of all major geographic regions of the world. Jamaica and Bahamas are the only countries in the CARICOM region that have served on the Council. Jamaica's continued presence on the Council will help to advance the work being done in promoting IMO requirements in Jamaica and the region. We'll turn now to the National Housing Trust and some special benefit orders. Cabinet gave approval for the following National Housing Trust special benefit orders. Moneymusk Glades Housing Development in Clarendon, which would facilitate 16 housing solutions, Roseneath Park Housing Development in Old Harbour, St. Catherine, with 35 housing solutions, and Masmure Flats Housing Development in Westmoreland, which would facilitate 8 housing solutions. All of the orders took effect on December 21, 2020. The orders are applicable to certain groups of contributors to the National Housing Trust. Cabinet also approved the issuance of drafting instructions to the Chief Parliamentary Council to facilitate the promulgation of the 3 special benefit orders. In terms of reports that were tabled in Parliament, the Cabinet received and approved the following annual reports and/or financial statements to be tabled in Parliament. General Legal Counsel 2019-2020, Administrator General's Department 2018-2019, Council of Community Colleges of Jamaica 2017-2018 and 2018-2019, Child Protection and Family Service Agency CPFSA 2017-2018. Montego Bay Free Zone Company Limited, 2017-2018, and 2018-2019. Tourism Product Development Company Limited, TPDCO, 2016-2017. The Company's Office of Jamaica, 2015-2016. The National Health Fund, 2019-2020. Let's move now to contracts. Cabinet gave approval for the award of a contract for the supply and delivery of 4 flow-serve horizontal pumping units for the gutters and spurtree facilities under the Greater Mandeville Water Supply Improvement Project in Manchester, Phase 1A to 9. The contract was awarded to Industrial and Municipal Supplies Incorporated in the amount of US $2,403,771.60. Cabinet also gave approval for the award of a contract for the Cathodic Protection System Rehabilitation Zone 6 and 7 Petrojam Limited to Barnaby Engineering and Testing Services Limited in the amount of $109,711,941.27. Cabinet gave approval for the award of a contract for the supply and delivery of 2,000 quarter-acre drip irrigation kits for the Ministry of Agriculture and Fisheries to Isratech Jamaica Limited in the amount of $125,675,795 inclusive of GCT. Cabinet gave approval as well for the award of a contract for the procurement of 16,000 packs of SD Bioline syphilis test kits and 1,000 packs of OraQuick HIV test kits in the amount of US $748,280, excluding GCT, to Recharge Distributors Limited. And finally, Cabinet gave approval for the award of contract for the supply of general chemistry reagents and analyzers for the Savannah Lamar, Falmouth, and Noel Holmes hospitals for 3 years in the amount of US $1,328,460.31 inclusive of GCT to Lasco Distributors Limited. Those were the decisions of Cabinet. I'd like to turn now to our schools as the final item for this morning. So just to recap, we would have started with our phased reopening of schools for face-to-face back in November of 2020 with a pilot of 17 schools, from which we got extremely valuable data that allowed us to continue with the phased reopening of schools. To date, a little over 400 schools have been approved for face-to-face. 300 of them have actually started back in the face-to-face mode. Many are utilizing not just the face-to-face, but also the online, the audiovisual, the learning kit approach. To the extent there are students that have not even cracked open their books, and they are not online, and they are not watching or listening to any lessons, we would have started our mobile intervention in which our teachers and some tertiary students go into communities and find these students and teach them in small groups of up to 5 for 1.5 hours, 2 times per week. So we're making every effort to reach our students because we recognize how quickly learning loss happens and how long it will take us to get students back to where they were before the pandemic. Across the schools that have opened for face-to-face, the care and attention to the COVID protocols have been observed pretty well at schools. Schools are careful to ensure that students have masks, although some schools have gone too far in terms of dictating what kinds of masks students would wear. Of course, the Ministry of Education, Youth and Information has been in touch with these schools to let them know that they need to be more flexible than they are being. Additionally, as a result of the Ministry of Education's directives and the Ministry of Health and Wellness's physical inspection. If you go to these schools that are open for face-to-face, you would have seen proper signage to reinforce these COVID protocols. The classrooms have been configured to ensure that social distancing happens, and many teachers have students not only physically in front of them in the classroom, they have students online at the same time that they're imparting, to whom they're imparting lessons. There has been a lot of effort on the part of parents, teachers, principals, and others to help our children continue learning even through this pandemic. And I want to say commendations to all our stakeholders in the education sector. One of the mechanisms that we've put in place and required of our schools is that they report to the Ministry of Education, Youth and Information religiously in terms of any incidents of actual or suspected cases. Not only that, but they have to report as well the action that they take once this is presented to them, so that at the ministry we understand the impact that the COVID-19 pandemic, the COVID-19 virus is having on our schools, and exactly whether it's our students or teachers or other support staff that are being impacted. In all the cases brought to our attention, the schools have handled it according to the Ministry of Health and Wellness's protocol. However, as you know, many of our students come from many different communities to attend school. Our risk-based model that has guided us in terms of our process continues to be used. We continue to input new data that we receive into the model. And as we analyze the data and as we go along, we cannot ignore the caution lights that we are seeing from this data. And so there has been a discussion this week with the Ministry of Health and Wellness. There's been a discussion with the cabinet at the cabinet level. And so this morning we called together our major stakeholders in the sector. That would include our principals, or members of the e-COVID task force, members of the JTA, just to give them an update as to what we're seeing in our schools from a global perspective. We understand that in each particular school, the principals and teachers would have their particular information, but we wanted to share with them from a global perspective and give them a sense of our thinking going forward, and that we did just before coming to this post-cab press briefing. And so what we would have told our stakeholders is that there has to be an adjustment in the go forward with our schools. And so at this time, we've indicated that our schools that are open for face-to-face are only allowed to have our exit exam students in the face-to-face mode, and that would be students in grade 6 at the primary schools and students in grades 11, 12, and 13 at the high schools. And in terms of the time frame for this, it's taking effect today until further advised. So in terms of the actual numbers, COVID numbers that we're seeing in our schools since we started face-to-face, as of February 21, 41 of our schools would have reported a positive or suspected case. Let me just get my actual numbers, that's correct. Okay. Total number of confirmed cases among our student population would be 47, and 6 suspected cases among staff. There would have been 23 confirmed cases and 18 suspected cases. So at this time, that's the adjustment that we're making to those schools that are in the face-to-face mode. We want to let all of Jamaica know that we continue to ensure that the tablet and laptop rollout continue. We will, as of the coming weeks, be handing over laptops to our PATH students in our high schools in grades 10 to 13. Additionally, we will be completing the remainder of the 40,000 tablet distribution. I believe we have about 5,000 left to go, and we are distributing those as well. We will also be informing those who are eligible to receive the $20,000 grant towards the purchase of a laptop or tablet. We have begun that process. Our pilot that we did has been done successfully, and so we are at the point now where we are sending out notifications to roughly 18,000 families to let them know that they can go to the vendor to complete their purchase. Additionally, we continue as well with our efforts under the One Laptop or Tablet per Child initiative, and every week there is an entity or an individual who has come forward to give us more tablets or more supplies for our schools. And we want to say thank you, and those devices and the supplies will go to the needy students in our schools. So I want to thank you very much this morning, and that concludes the update that we have in terms of the decisions from Cabinet and the new direction and adjustment from the Education Ministry. Thank you.
Mr. Williams, thank you so much for your comprehensive overview on the Cabinet deliberations over the past 2 weeks, and in particular, too, the announcement this morning concerning face-to-face classes. And so we have some questions from the members of the media. Again, prior to your arrival, Minister, we did brief members of the media. Please use the raise hand feature in Zoom so that we will be able to entertain your questions and have Ministers Williams and Morgan respond. We also have a support team from the Ministry of Health led by the Permanent Secretary, Mr. Dunstan Bryan. And so, ladies and gentlemen of the media, you use that raise hand feature so that I'll be able to call on you and you can ask your questions. Please ensure your microphone is on, is not on mute, so that you are able to get the audio out well. Are there any questions this morning? While the media gets ready, Minister, there is a clarification that's being sought by a member of the public on Zoom, and I'll just ask, how do we report COVID breaches in schools? And that's a very important one. You did allude to the fact, Minister, that schools are required to report to the ministry if there is a positive COVID case. But I believe this parent now is asking, how do you report any breaches that the school may be having? So, Minister, I'll turn that over to you.
Sure. I know from time to time, concerned parents and observers of our schools would see particular breaches, and they have called the Ministry of Education, Youth and Information. And in all the cases that have been reported to us, we ensure that we are in touch, we understand what the gaps are in those schools, we speak to the principal, we ensure that corrective action is taken. And so we would encourage all our stakeholders or parents, if you do see breaches, please report them to the ministry so that we can act. Thank you.
Thank you so much, Minister. And now we go over to members of the media. We have Mr. Javon Keys from TVJ who has a question. Javon, would you be able to unmute yourself and turn your camera on, or certainly have a photo up? Javon?
Good morning, everyone. Are you hearing me?
Loud and clear. Go ahead, Javon.
All right. My question is regarding the Jam COVID app and the breaches. I wanted to find out how has this now impacted the government's relationship with the Amber Group? One, two, how has what has the audit so far unearthed? We know that it was said that it's shown that no one so far has really been impacted, but what else has the audit found? And my final question is now regarding the Ministry of Health and its mechanism as it relates to tracking positive COVID-19 cases. Would the government say that there is currently a difficulty in getting to persons who have tested positive for COVID-19 and making contact with them in giving them their quarantine orders and other communication necessities?
For Javan, I'm going to ask Minister Morgan to take your first question.
Indeed, and Minister, of course, we do have representatives from the Ministry of Health, including the PS, who is also online, so we can have some of those answered. But okay. Minister, you were saying to Minister Morgan.
Right, Minister Morgan, if you would take that first question. Minister Morgan has direct responsibility for the information portfolio.
Thank you, Minister. You asked three questions. One was the relationship between the government and the Amber Group. The second one was the audit. And I don't remember what the third had to do with health. All right, so for the first question, I don't know if there's any information out there about that I could report on regarding the relationship. The fact of the matter is that challenges were unearthed. It's not strange that websites would demonstrate vulnerability. It happens all the time. We have recent cases where the Pentagon was hacked. We have recent cases where several other major websites were hacked. I think what is important is the actions post finding out the information. And based on my communications with the Ministry of National Security, they are currently looking at every single government-related websites to see if there are any vulnerabilities that exist there, and also to fix whatever vulnerabilities. You would have known, it was public knowledge reported by the Gleaner, that the CPFSA website had some challenges, and we were able to fix the challenges, and it came back up within about 3 to 4 hours. That process continues. The whole issue of web security is an evolving issue. Vulnerabilities come up all the time. But what I can guarantee you is that work is being done every day. The systems are in place. They are working as they should to find where problems exist, to fix those problems. As it relates to the audit, that is a matter that the Ministry of National Security would have to comment on. I suspect that the country will be updated in the coming days with more details as to what exactly happened and what has been done to solve the challenges that have been unearthed.
Mr. Morgan, the Permanent Secretary at the Ministry of Health and Wellness is also on our Zoom platform. He may want to also respond to the third question concerning some contact tracing mechanism. Mr. Bryan, good morning to you.
Good morning, and good morning, Minister and Minister of State, and good morning, colleagues and members of the media. The issue of contact tracing still remains a critical tool in the public health response to COVID-19, and our public health officials, including persons who we have contracted as community health aides, continue to do the necessary contact tracing of persons who have been identified in the population as being COVID positive. One would well understand and appreciate that given this spike in number of cases, the ability of the public health system to reach persons within the standard of 48 hours after receiving the test result, that has become more difficult to maintain. However, we are ensuring that all persons receive their results in the shortest period of time, and that once the results has been identified, we continue to do the contact tracing. What is most important for the public to understand is that we have been in community transmission for some time now, and the protocols are critical in terms of adhering and being compliant. The importance message for the public is that given that we are in community transmission, one, your posture is that everyone is positive, and therefore you adhere to the protocols in order to protect yourself and to protect the person who you may come into contact with. Therefore, you must sanitize, you must wear your mask, you must keep the physical distancing, and you must stay home if you have any flu-like illness, and then contact the relevant agency to ensure that you get your test and then you will get your result. But the most important function has to be that we maintain the infection prevention control measures so that we contain the spread, and we ensure that even if we are asymptomatic, we come into contact with persons, the likelihood of you infecting another is reduced because you maintain infection prevention and control measures. So yes, we continue to do contact tracing. Yes, contact tracing remains a part of the tools for the Ministry of Health in terms of our public health response. However, the message that must ring out is the adherence to the infection prevention and control measures.
Yes, Brian, I understand that, but the question is there or is there not a challenge? Because we are getting reports of persons who claim to have tested positive but have not been contacted by the Ministry of Health. And it's more than the 48-hour threshold that you have reported.
All right, so Mr. Keys, I did say that it is because of the spike, there is a challenge in maintaining the standard. I did say that. But I'm saying as well that once you have been tested, you should understand that you are at a higher risk and therefore you maintain the protocols. But there is a demand side push that makes our ability to respond more challenging, especially with in the context of the protocols and the standards.
Thank you so much, P.S. Brian. Let's then go back to the Zoom. I believe Mr. Edmund Campbell from the Gleaner had his hand raised. While we get Edmund's mic unmuted, Edmund, could you ensure that your mic is unmuted again, and also that that your camera or photo is up? Mr. Campbell?
Morning, thank you.
Yes.
Just an inquiry regarding the schools. What kind of feedback has the ministry been getting from the leadership of the schools in relation to preparations for both PEP, CSEC, and CAPE exams? Because we knew of what happened last year with the exams. We want a repeat of those situations where persons were challenged to a large extent. What plans are in place? Are things going smoothly? What kind of feedback are the principals giving to the Ministry of Education right now, and what can the ministry do to provide additional support?
Okay, thank you for that question. I'm going to ask our Chief Education Officer to respond. Thank you.
Thank you, Minister. Good morning, everyone. So our principals have been working with us, and they are conscious of the difficulties that the region is experiencing at this time with respect to our CXC examination and also our other exits, CT and Gales NCT vet. So we have started our consultations with them. They are fully aware of the options on the table at this point in time for all the examination bodies. They have shared with us their feedback concerning the challenges with the limited contact time that they are having with their boys and girls. We also would have been working with them And that is why primarily our minister spoke this morning to them about allowing the exit students, those in grade 6 for our primary level exams, those in grade 11, 12, and 13, to be afforded the opportunity of face-to-face so we can maximize on the teaching and learning opportunities so we can prepare our boys and girls. So we have been working with them. They are anxious, they are nervous. Our minister informed them recently as well that there is a pending meeting with CXC to treat with the final decision concerning the sitting for the 2021 examination. We are awaiting that meeting. It's supposed to be convened this Friday with the region and CXC, and post that meeting we will reconvene with our principals to sensitize them of the final directive with respect to the sitting, and then we will have discussions concerning the way forward as we work together to prepare our boys and girls. With respect to PEP, we are in discussion with our primary level principals. We have several options on the table with respect to adjustments that we will have to make concerning the pandemic. Once there are changes in the spike, we have different options available to decide how we transition our boys and girls. We are awaiting further updates from our psychometrician, and then we will convene with our principals to discuss the possible adjustments and by what time we will be able to take those decisions. So things are in place, and we continue to have dialogue with our key stakeholders, our principals. Of course, our parents send information from time to time and give us recommendations, and we incorporate that in the planning. Thank you.
Thank you, CEO Dr. Troop. Let's then go back to some more questions from members of the media. Mr. Arthur Hall from the Jamaica Observer. Mr. Hall, good morning.
Good morning, Minister. Good morning to all the persons there. Just quick check for the Education Minister. How many schools have started face-to-face and have cancelled it since we resume face-to-face?
So, Arthur, as of February 21st, it would be just a little over 300 schools that are actually operating in the face-to-face. We have approved well over 400, and we continue on that effort to ensure that we do the inspections along with the Ministry of Health and Wellness to continue to approve our schools. But we allow our principals and teachers the flexibility. They are on the ground. They understand the situation. And so that's why when you look at the numbers of approved school versus those who are actually operating in the face-to-face mode, there is a difference in the numbers. And I'm sorry, so I think you just asked about the numbers. Was there anything else?
Yes, Minister. We've seen some schools which had opened for face-to-face and have since closed their doors. Do you have numbers for that?
Right. So the schools that would have closed for face-to-face would be those schools that have experienced some actual COVID cases. And a case in point would be Monroe, that started in the face-to-face mode. They experienced quite a large number. And so they've taken the decision, of course, after informing the Ministry of Education and us working together with them, to revert to the online mode until the case works its way through in terms of quarantine, testing, and so on. They would have done their deep cleaning as well, their sanitization of the schools, and continue to monitor the situation. In other cases, we have seen where other schools have pulled back a little bit in terms of a week or so or a few days to allow for the area to be sanitized, but we have not had any whole-scale close down of schools for ones that have gone back face-to-face.
Thank you, Minister. Are there any further questions from members of the media who are on the Zoom platform as we look to close? And Minister, as we look to close and we await to see if there are any further questions, and in the nick of time, Michael Sharp from JNN has a question for you. As we close, Minister, if you could, and we're just being asked by persons on the stream as well, for you to just reiterate those points concerning schools going forward and the announcement made this morning. But before you do that, Minister, let's just take the question from Michael Sharp, and then we can close for this morning. Mr. Sharp, good morning to you.
Yes, good morning. I'm asking as it relates to the new direction. I just want a full understanding based on what my colleague Arthur Hall just asked. If you're just asking the students who are doing exams to come in for them to be allowed, does it mean that the other grades can stay home? I just want to be absolutely clear.
Right, so the other grades would stay home. We are asking those students to revert to the online system and the other approaches that are available to them, which would be the audiovisual approach, where we continue to have lessons broadcast on TV, aired on radio. We ask them to be in touch with their teachers. They have their textbooks, they have their worksheets, and we will continue with our mobile intervention as well, in which we go into the communities with our small groups of students who have not been engaged with the school system. So we're asking our principals, our teachers, our parents to work with us on this as we all live through this pandemic. And for the moment, the adjustment that we're making is that for face-to-face, we're asking that it only be the students who are in our exit exam grades, which would be grade 6 in our primary schools, and grades 11, 12, and 13 in our high schools.
Thank you so much, Minister. Again, for the persons on our stream, especially for those parents, they're asking you, Minister, if you could just reiterate the announcement of the morning concerning face-to-face classes in schools, and of course the mobile learning approach that the ministry is also utilizing along with the other approaches to ensure that our children are met at this time in terms of their learning needs. To be abundantly fair, there is one other hand I see raised on our Zoom platform, Minister. I'll just take that as the last question, and then we can go into our close. So I'll take one final question, and that's the only hand I'm seeing on our Zoom platform at this time, and therefore that will be the last question we take this morning. That now is from Mr. O'Shane Masters of TVJ. O'Shane, good morning.
Hello, good morning. O'Shane Masters from TVJ. To Minister Williams, what, if any, role did EGOV Jamaica play in the development and testing of the app before it was launched? That's the Jam COVID app.
As I said before, this is a matter that is currently under investigation to come to all the facts that need to be communicated. I do not want to preempt announcements that are going to come in the coming days. A lot has been said over the last couple of days about the matter, and I think the decision has been made to let us look at the facts, let us understand the processes that have taken place over the last several months, and then come to the nation with a fulsome understanding of what took place, what didn't take place, what have we done since the information came to the fore, and what we'll be doing going forward. So I think in light of everything that has taken place, I think the authorities, the MNS, Ministry of National Security, EGOV and others should be allowed to gather all their information and then come in the next coming days to outline to the nation fully what we're doing, what has been done, and what should have been done. Thank you.
Thank you so much, Minister Morgan. And now, as we close the post-cabinet media briefing, we just ask Minister Williams to, again, for the parents who are listening and for those on our stream and for the general information for those who may have joined late, the announcements of the morning coming out of the Ministry of Education, Youth and Information concerning face-to-face schools.
Okay, just to recap, for schools that are operating in the face-to-face mode, we have made an adjustment, and we have directed that those schools in the face-to-face mode only have students back from grades 6, which is the exit exam grade in our primary schools, and students in grades 11, 12, and 13. All other students would be required to stay at home and utilize the online learning platform or the audiovisual approach, which would be watching the lessons on TV, listening to lessons on radio, and we do have a national schedule that has been published to inform all our students and parents as to what time these lessons would be on. We're also asking students to collect, if they haven't done so, all those parents who haven't done so, to collect the textbooks and worksheets for your students so that they can keep abreast with what's happening. They can be in touch with their teachers. They can do the work, the lessons in the workbook, and have those marked and graded by their teachers, and there can be interaction with the teachers. So again, to repeat, for schools that are operating in the face-to-face mode, only students who are in grade 6 should be at school in the face-to-face mode, and in our high schools, it should only be students who are in grade 11, 12, and 13. And we're encouraging all our principals and teachers to utilize the rotational approach, meaning they can have some students at school while others are online. And if they have all of these exit exam grade students on the campus, they can spread them out all over the campus now that you will not have the other grades there to occupy that space. We are living through this pandemic. We have to do everything that we can to get all of us through it safely. These are some of the changes that we have to make. And as soon as we have other changes or updates, we will advise you. At the moment, for the face-to-face, grade 6 in the primary schools and grades 11, 12, and 13 in the high schools.
Thank you so much, Minister Williams, for availing us of the information, and certainly to Minister Morgan for his interventions in responding to the questions from the media. May I thank everyone from the media who have been on our Zoom platform, as well as those who've been here with us at Jamaica House, the banquet hall, for joining us for post-cabinet media briefing. Please, ladies and gentlemen, stand by. We'll have, of course, several other updates coming out of government as the period progresses on any matter certainly that is of national importance. Thank you so much for joining us this morning. May I wish for you a very good day.